Hi, I'm Amanda Webb, and I am the nursing supervisor for the CSU Health Network, who oversees the nurse clinic at the Mountain Campus. The purpose of this video today is to provide school staff, health techs, and school nurses best practices for preparing forms and medications for your ECO experience. A little bit of information about the Mountain Campus Nurse Clinic. 1 to 2 nurses are available during the ECO experience. We utilize standards of practice, benchmarks, and policies and procedures to drive our patient safety, which is why, in fact, that we ask for information and documentation 5 days prior to the visit. As far as the nurse clinic in general, it's a small, limited space, so we always want to take advantage of what is necessary up there. The Mountain Campus Nurse serves as an emergency and urgent resource for first aid given needs, as well as for medication administration. And no over-the-counter medications will be administered without a signed authorization form. To the left of the screen is the ECO Experience Emergency Contact and Health Information Form. On the right is the ECO Experience Medication Administration Form. At the close of this video, I will mention how to access a copy of each of the forms. Any child requiring medication administration at the Mountain Campus will require both an emergency contact and health information form as well as a medication authorization form. It's important to note that we will accept a copy of the health history and medication authorization form that are on file with the school. To be eligible, it must be completed within the last year. All medication forms must be signed by the student's prescribing medical provider, even for over-the-counter medications. Any medication without a signed authorization form cannot be administered at the Mountain Campus. The only time a new medication authorization form is required is for a medication that is not currently on file with the school. Again, it does require completion with a provider signature. For any student with a plan of care, we require a copy of this. This would include both medical and mental health diagnoses, such as a severe allergic reaction, diabetes, epilepsy, asthma, bipolar disorder, suicidal ideation, schizophrenia, severe depression, and severe anxiety disorder. For any child receiving a scheduled medication or as needed, we ask that they be packaged in a clear Ziploc bag with their last name, first name, and date of birth. Medications will be stored inside. They should be in their original packaging, prescription, and over the counter so that we can see expiration dates as well as prescribing provider as well as dosing on the bottle, as well as a copy of the medication authorization form inside. Once all student medications are packaged in their individual Ziploc bags, we ask that you use a plastic tote and alphabetize them. Please label the tote with the name of the school, dates of ECO experience, as well as then medications. Upon arrival at the Mountain Campus, we ask that the lead teacher or staff representative deliver the tote to the nurses clinic located in the main dining hall. An important reminder, all emergency medications should be with the student or assigned teacher at the time of arrival to Mountain Campus. Examples include inhalers, EpiPens, and Baqsimi. Example on the screen represents a best practice tip for documentation. A simple Excel file that includes the name of the school and then each individual student with every medication listed, the dose, the route, and time of medication administration. Once all medications have been checked in by the Mountain Campus nurse, they will create a copy of the form shown on screen. A copy of this form will be given to the lead teacher or staff at the first meal after arriving on site at Mountain Campus. Any communication regarding delegated medications will be reviewed and discussed at this time. Please note, medication delegation will be detailed further later in the video. What to expect regarding communication with the Mountain Campus Nurse. The Mountain Campus Nurse will outreach via email to the school contact 3 weeks prior to arrival with an overview of the requested forms. The Mountain Campus email, CSU_MTC Nurse at colostate.edu. This is the email you will use to send copies of both health histories and medication authorization forms. Please send as scanned document to the email previously provided, title of document as school name, date of arrival, type of form. This needs to be sent as an encrypted email. If you need to send additional documents, please attach and label appropriately. We ask you do not send the entire file again. The CSU Mountain Campus Medical Clinic may utilize medication delegation when a teacher, aide, or district employee has met the annual training requirement. Training must be completed within 1 year of the individual's arrival date at the Mountain Campus. The staff member's full name and date of training must be provided in writing to the Mountain Campus nurse staff prior to their on-site visit. Delegated medications will be provided at the mealtime prior to the scheduled administration time and will be labeled in individual medication envelopes. Applicable paperwork may be included. Delegation shall not occur without written confirmation from the school nurse or school district nurse that the delegate has completed the required annual medication administration training. Delegation shall not occur unless the Mountain Campus nurse determines in their professional judgment that the task can be performed safely and appropriately by the delegate and that the delegation is in the best interest of the patient's safety and welfare. The delegating nurse is responsible for determining the appropriate level of supervision required. This determination will be based on an evaluation of relevant factors, including but not limited to the stability of the patient, the training and competency of the delegate, the nature of the task being delegated, the type of medication to be administered, and whether the task has a predictable outcome. The initial Mountain Campus nurse outreach to the school contact or school nurse should include a request for confirmation of whether any teachers or chaperones currently hold or will hold delegated status. If delegation occur, the school nurse must provide the following information in writing to the Mountain Campus nurse prior to the school's arrival: full name of the delegate, date of completion of annual medication administration training. Individual medication envelopes will be clearly labeled with the child's first and last name, as well as the date, time of administration, and name of medication. Delegated medication envelopes will be provided to the designated teacher at the meal immediately preceding the scheduled administration time. Thanks for watching our video in entirety. Our goal at the Mountain Campus Nurse Clinic is to provide a safe environment for medication administration and first aid care. If you have any questions regarding our processes or to request a copy of the forms, please email amanda.webb@colostate.edu or our Mountain Campus Nursing team at CSU_MTC Nurse at colostate.edu. We look forward to a fun and exciting eco experience season. Thank you.